I'm Dr. Jen with Family Pet Veterinary Centers, and I'm with Dean here today. He's going to read some questions we've gotten about dentistry procedures in dogs.
Thanks, Jen. So how often does my dog need a dental exam, and how do I know they need one?
Well, that's a little bit a dental exam or dental procedure. Anyway, a dental exam is what I consider an awake oral exam. And that's something we do every time they come in for anything. But we usually like to do it twice a year with our wellness visits. A dental procedure is kind of a loaded question. That's something that we should do at least yearly. And studies show that smaller dogs that don't have home care actually get bone loss around teeth. All of them get all but one got bone loss around teeth within a year. So sometimes it happens faster than we like. But a study of all sizes of dogs showed that about 44% had a problem the following year after a dental procedure, and only 15% when there was dental home care daily. So I guess that's saying that typically every year is needed. Every pet needs an anesthetic dental procedure every year because there's things that are hiding, and some of them need it more frequently.
Okay. So how do I know if my dog's teeth are causing them pain?
Well, that's the problem. They won't show it. The only way to know is to look at imaging, because we want to look at the roots. You can flip the lip and you can look at the crown, but it's the roots. It's 2/3 of the teeth underneath the gum line is where these painful things are hiding, and you can't see it. I've had dogs with teeth practically falling out of their heads, but the owners didn't know it. And then we treated it, and the pets were so much more puppy-like, we didn't know that pain was going on at the same time.
Mm-hmm. Okay. So is there anything I can do to help my dog prepare for a dental procedure?
Prepare for an dental procedure typically is just withholding food. Sometimes we want to use gabapentin or trazodone, some of our fear-free meds, because we do things in the office to lower the FAS, which is fear, anxiety, and stress of our patients and our clients. We try and minimize those things. And in doing so, we get a better quality of anesthesia, and we can usually have a shorter procedure as well. And that's why we like to either preemptively medicate some of the patients, but a lot of them don't need it. We preemptively medicate them here to make it safer and easier on them.
Okay. So will my dog be getting dental x-rays?
Well, that is something that's standard in our practice. Not every practice makes them standard. Not every practice uses full mouth imaging, and not every practice has even dental imaging capabilities. It's really important because at least 72% of dogs have a hidden problem at any given time. And that means 3 out of every 4 patients that I see actually has a problem. In my experience, when I've gone and looked, 97% of my patients have had something hiding. But it's not 100, it's just pretty darn close. And that's why we have to look at the 2/3 of each tooth underneath the gum line. And we use intraoral x-rays, which go in the mouth, and they're little sensors that goes there. It's digital. Or we use this machine here to get a full scan in about a minute, and then interpret that while the team's cleaning up the teeth. So
Okay.
we don't do the treatment until we've talked to you about it.
Gotcha. So how long does a dog dental procedure usually take?
So from start, we have them here all day typically, or at least the morning. From start to finish, we start with pre-meds, we make sure they're comfortable, and we induce them, and we get images, and then we clean the teeth. And so all of that stuff takes at least 45 minutes, around 45 minutes. And then once we find problems, we talk to you about that and decide if we're going to treat that there and then that can add to the time, and it can vary a lot. All depends on what's going on.
Okay. So if my dog does need extractions, will he be given any pain medication?
Well, pain meds is something that I'm very much a believer in. We usually use nerve blocks, but we also start with pain meds before, during, and after the procedure. For example, all of my patients get Serenia, which is labeled as an anti-nausea drug, but it's important because it helps with anesthetic recoveries, and it is a pain management drug. It's just not a standalone pain management drug. They're given opioid meds before. They're given nerve blocks and things to extend the nerve blocks, the pain control, not the numbness, during the time up to 3 days after. And then they're also given pain meds to go home when indicated. So we don't skimp on pain meds, but we do a little bit of a lot of things so there's no side effects or negative effects of pain meds.
Okay, well, that's all my questions. Thank you, Dr. Jen.
Thanks.
Yep.